Hi everyone, and welcome to the Autoimmune Dietitian YouTube channel. My name is Annie. I'm a registered dietitian and I work with people struggling with autoimmune diseases. So in my work with my clients, I help them use food and nutrition as a way to help them feel better, reduce their pain, give them their energy back, and hopefully help them live with their autoimmune disease as they were living without it. So today we are talking about rheumatoid arthritis, and rheumatoid arthritis is the third most common autoimmune disease. This disease affects the joints and it can be a debilitating condition if not managed properly. However, there are a lot of alternative treatments to consider when living with RA. So today I'm going to describe what this disease is, how it's conventionally treated, and what alternative options you can investigate to help you live a normal life with rheumatoid arthritis. So before I jump in, I need to attach a disclaimer to this video that the information in today's talk is not the substitute for the diagnosis, treatment, or care of disease by a medical provider. This is for informational purposes only. So please consult your qualified health professional for any changes that you make to your medical care. All right, so what is rheumatoid arthritis? Rheumatoid arthritis, or RA, is an autoimmune disease that attacks your own body's tissues. So it mainly affects the joints, but it can also affect other body systems, including blood vessels, your eyes, your heart, your lungs, and your skin. So most people with RA see this disease affecting joints on both sides of the body. So in other words, it's a symmetrical attack on the joints and tissues. When the body attacks the tissues, the immune system releases inflammatory chemicals that destroy the synovium of the joints. The synovium is the tissue lining the joints that helps the joint move smoothly. So when this tissue is destroyed, it becomes thicker and causes pain in the joint area. And then as the disease progresses on the joint and the damage continues on that synovial tissue, it can become difficult to move and eventually may become deformed. So what causes RA? The underlying cause of rheumatoid arthritis, like other autoimmune diseases, is unclear. Women are more at risk of developing RA than men. In fact, women are 3 times as likely to get RA than men. Other risk factors include genetics. So having a family member with RA increases your risk for developing this disease. Smoking. So long-term smokers are at higher risk of getting rheumatoid arthritis. For those who have RA and continue to smoke, it increases the severity of their disease. Obesity, so those who carry excess weight are also at higher risk of developing RA. And then environmental exposures. So infections and toxins have been linked to autoimmune diseases in general and the development of autoantibodies, which was present when your body starts to attack itself. And the last one is emotional trauma, which is something that people don't really think about, but having adverse childhood experiences, having a lot of stress, being a victim of abuse and neglect are all underlying causes of autoimmune diseases in general. And in fact, one study found that adults with RA and those that had a history of trauma had more pain than patients with no history of trauma. So what are some conventional treatments used for rheumatoid arthritis? So again, the goal of conventional treatments is to lower inflammation. When there is less inflammation, the disease is less active. So there are a handful of options now for rheumatoid arthritis patients to consider in terms of medications. And these are, and this kind of goes in order of how kind of severe the medications are, I guess. So the most kind of basic gentle medication are your non-steroidal anti-inflammatory drugs or your NSAIDs. These drugs block prostaglandins, which are substances that your body makes at inflammatory spots in the body. So blocking prostaglandins helps stop inflammation. So these include things like Advil, Motrin, and Aleve. Those are all NSAIDs. The next kind of line of defense are corticosteroids. So these drugs reduce inflammation by mimicking cortisol, which is your stress hormone in your body, but that hormone also has anti-inflammatory properties. So prednisone is an example of a corticosteroid. And these are fast-acting, but not to be used in the long run. The next level of medications are called disease-modifying anti-rheumatic drugs, or DMARDs. So DMARDs slow down inflammation that attacks the joints. They are not fast acting, which is why they are usually used in conjunction with other medications until they kick in. Some doctors will use a combination of DMARDs to reach the desired effect. So DMARDs include things like methotrexate, which is kind of the gold standard, which everyone mostly starts with when they are diagnosed with rheumatoid arthritis. Otezla, Xeljanz, and Rinvoq. Those are all standard DMARDs. And then the last kind of class of drugs are biologics. So these are actually a type of DMARD that are a lot more powerful and typically more expensive to make. So usually these are administered either through a injection or a shot or as an infusion. So each biologic works on a different part of the immune system to help stop inflammation. So for instance, there are TNF inhibitors that block tumor necrosis factor, which was what TNF stands for, and these are inflammatory proteins. There are also like B cell inhibitors that interrupt B cell signaling, and then there's a bunch of other ones. So those are the medications, a conventional pathway that most doctors will take when they are treating someone with rheumatoid arthritis. But what are some of the alternative options out there? So while there's no cure for autoimmune diseases in general, and conventional treatments can be very effective, but not all people respond to conventional treatments. So if you're still struggling with joint pain, what else can you consider? So here are some options. The first one is diet. So obviously as a dietitian, this is one that's kind of near and dear to my heart and has helped me. I have rheumatoid arthritis. This has been a huge game changer for me. Diet plays a pretty big role in systemic inflammation. So by switching to a more anti-inflammatory diet or, starting to look into food sensitivities and, working on gut health, which is all kind of, again, affected by diet, that can help support your body to fight inflammation. So there's a lot of bioactive components in plants and animal products that are very effective at fighting inflammation. Supplements is another route you can take. Omega-3 fish oil and turmeric are two of the most studied supplements for rheumatoid arthritis. Both have been shown to lower inflammation and joint pain. Third is stress reduction. So again, not something a lot of people think about, but stress is a huge trigger for RA flares, and learning stress reducing techniques by way of like meditation, deep breathing, visualization, all those different strategies can help you lower stress and inflammation. Getting adequate sleep. So sleep is super important for regulating and controlling inflammation. So high quality sleep is really key here. And then movement. So keeping your joints moving is critical for joint health and mobility. There are a number of videos you can look to on YouTube for joint exercises for specific body parts like hands, feet, ankles, which are generally the joints affected by rheumatoid arthritis. In addition, just moving your body as a whole can help keep inflammation in check. So that's kind of an overview of rheumatoid arthritis. I hope you enjoyed this video. If you would like more help managing your autoimmune disease, please reach out to me. There's a link in my profile to schedule a free call. While you're there, you can also check out my website. I have a pretty extensive blog about lots of different topics about autoimmune diseases and how we can use nutrition and lifestyle as a way to help us feel better. And then lastly, if you enjoyed this video, please hit the little subscribe button. These come out about every week, and I'm just here to help you understand more tips and tricks to live with your autoimmune disease and hopefully live happily with it. So thank you so much for joining me, and I will see you next time.